Calcific pancreatitis associated with alcohol use. Causes. Excessive and prolonged alcohol consumption is the most frequent cause of chronic pancreatitis. There is a direct relationship between the amount of alcohol consumed and the risk of chronic pancreatitis. In Spain, 85% of cases of chronic pancreatitis are alcoholic, although only a minority of excessive drinkers develop the disease.
Chronic pancreatitis. Chronic pancreatitis is caused by long-term inflammation of the pancreas, which eventually leads to the irreversible destruction of pancreatic tissue. Chronic pancreatitis develops slowly over time and is predominantly triggered by lifestyle factors in predisposed patients, such as long-standing heavy alcohol or tobacco use, although this is not always the case. Other less common causes are medications that put stress on the pancreas, elevated triglycerides, some autoimmune conditions, and some inherited or genetic conditions, notably cystic fibrosis and hereditary pancreatitis. In some people, the cause of chronic pancreatitis is never discovered and remains a mystery. The pancreas is a digestive system organ that has two important functions. It produces hormones that regulate blood sugar, as well as enzymes to break down food in the digestive tract. When the pancreas doesn't work properly, it affects the body's ability to properly digest food. This means that some people with chronic pancreatitis are unable to get the nutrients they need from the food they eat. They can have trouble digesting food properly or maintaining their blood sugar in a healthy range. This can lead to nutrition-related disease such as weak bones and vision loss. Some people may also have difficulty gaining or maintaining their weight and persistent pain. The hallmark symptom of chronic pancreatitis is abdominal pain. The pain may be intermittent or chronic and is frequently very severe, with stabbing pains localized in the upper part of the abdomen between the belly button and the chest. The pain may radiate to the back and may be triggered by eating, especially high-fat foods. As the disease progresses, the pain may become more severe and debilitating, and often it becomes constant. In some cases, surgery or endoscopic treatment may be required. Oily, foul-smelling bowel movements and weight loss may be seen in the advanced stages of the disease and usually signals exocrine pancreatic insufficiency. As well, depending on the severity and extent of the damage to the pancreas, some people develop diabetes. A combination of tests are used to diagnose chronic pancreatitis. In some people, diagnosis is challenging due to the course of the disease. However, in others, it is relatively straightforward. A CT scan of the abdomen is the most commonly used test. An MRI or endoscopic ultrasound may also be used to confirm the diagnosis. In some difficult-to-diagnose cases, pancreatic stimulation testing can be useful. This test artificially stimulates the pancreas using secretin. This test is expensive and invasive, so it is not frequently performed. Blood tests are not useful for diagnosing chronic pancreatitis. Although there is no cure for chronic pancreatitis, early diagnosis and treatment can help slow the progression of the disease. Treatment involves avoiding triggers, such as heavy alcohol use, smoking, and high-fat foods. Other treatment interventions involve pain management, medication such as pancreas enzyme replacement therapy, PERT, and supporting a healthy diet with multivitamin and mineral supplements.
Symptoms. The most common are pain, diarrhea, loss of weight, jaundice, vomit, and deficiency of vitamins. Diagnosis. magnetic resonance, ultrasound, computerized axial tomography, CPRE, and pancreatic juice analysis.
How does alcohol causes acute pancreatitis? Alcohol abuse is one of the two most common causes of acute pancreatitis. Alcohol induces the secretions of pancreatic juice with high protein concentrations and a low fluid content. So these viscous pancreatic secretions are prone to precipitations, forming plugs that can obstruct the lumens of the pancreatic ducts. Furthermore, alcohol can also causes spasms of the sphincter of Oddi, and it has a direct toxic effect on the acinar cells, and which together with the increase in the pancreatic secretions of high proteins and low fluid contents causes the acute pancreatitis.
Clinical case. A 50-year-old man presented to the emergency department with sudden onset of hematemesis. He reported a 2-month history of epigastric pain and full-smelling diarrhea. He had been drinking half a pint of vodka a day for 15 years. Physical examination revealed epigastric tenderness. Results of laboratory testing, including serum lipase and liver function tests, were within normal limits. A computed tomography scan of the abdomen showed extensive calcification of the pancreas without evidence of pancreatic edema or peripancreatic fluid collection. Findings consistent with chronic calcific pancreatitis. Endoscopy revealed gastric ulcers which were treated with acid suppression. Chronic alcoholic pancreatitis is a common cause of pancreatic calcification. Treatment of chronic pancreatitis typically includes pain management and correction of exocrine pancreatic insufficiency. This patient had an uneventful recovery. He was discharged with pancreatic enzyme supplements and was enrolled in an alcohol abuse rehabilitation program. Thank you for watching.